Hi, this is Dr. Dennis Skindia. It's great to be with you again. I'm going to be talking about Behavioral Health Disorders Prework Module 2C, which is a discussion around psychotic disorders, what they look like, what you might expect to see, and a little bit about treatment. So the learning objectives here are that you'll build an awareness of what the term psychosis actually means, and that you'll build awareness of the symptoms that are associated with one form of psychosis, which you're probably highly likely to encounter, and that is schizophrenia. So let's talk a little bit about what psychosis is. So psychosis is a disorder of thought characterized by an inability to perceive reality as evidenced by, and these are the two hallmarks of psychosis, delusions and/or hallucinations. So psychosis is a disorder of thought, which differentiates it from disorders of mood, like we've talked about before, that's characterized by a break in reality. And the two hallmarks of psychosis are depressions and/or hallucinations. So what I'd like to make clear is that schizophrenia is one type of psychotic disorder. There are a number of different psychotic disorders, but schizophrenia is the one that you're probably most likely to encounter in your work. So, what is schizophrenia? It's chronic. In other words, once you have the diagnosis of schizophrenia, typically it's going to persist. It can be very severe. These delusions and/or hallucinations can be very debilitating. It affects how a person thinks, feels, and behaves. So it affects all three of those spheres. It may seem like the individual who is psychotic is out of touch with reality. In the sense they are. When you're having a delusion or you're having a hallucination, many times that person will appear as if they've lost touch with reality. And fortunately, it's not as common as some of the other mental health disorders. But again, it can be very, very disabling. The onset typically of schizophrenia is in late adolescence or early adulthood, typically 16 to 18 around onset. And I guess the good news is that if you've not had that diagnosis by 30, it's probably unlikely that you will receive that diagnosis. There are categories of symptoms that are positive, negative, and also cognitive. The positive symptoms that we see in schizophrenia truly disrupt a person's experience of reality. They are hallucinations, delusions, and also sometimes you can see disorders around thinking and also behaving, which we call movement disorders. Sometimes there'll be disorganized thinking, there'll be disorganized speech, and there's sometimes disorganized behavior, which sometimes we call catatonia, in the clinical literature. There are also negative symptoms of schizophrenia, which are disruptions in normal variations of mood. What we see many times in clients with schizophrenia is what we call flat affect. That is, they will have no emotion. They'll appear as if they're an empty shell. They will have very reduced feelings of pleasure in everyday life, which we call anhedonia. They'll have difficulty maintaining activities, sustaining activities, and they'll have reduced speaking. So someone who's actually schizophrenic many times will not engage in much speaking. You'll try to speak with them, and you won't get much of a response at all. When you think about the cognitive symptoms of schizophrenia, we have changes in executive functioning. And when we think about executive functioning, what we're thinking about is the ability to plan, the ability to sequence our lives. You know, many of the things that you do every day to get through your day successfully, to make sure you have your lunch, to make sure you pick up your child if you need to do that. These are issues around executive functioning, planning, the ability to see things through to sequence. These are the kinds of things where you have a significant deficit if the client has schizophrenia. Difficulty in focusing and paying attention. They're easily distracted, and problems with working memory. Many times clients with schizophrenia just will not remember things in the here and now, in the immediate. There's sort of a myth that people with schizophrenia are dangerous. I would say that they're no more dangerous than anyone else. They're probably in many cases more dangerous to themselves than they are to others. Obviously, the risk of being dangerous or becoming, feeling like there is some danger escalates if they're not successfully treated. And it's also important to help a person with schizophrenia get treatment as soon as possible, because the longer this disorder goes on, typically the more serious and debilitating it can be. The other issue I would say is that clients who are schizophrenic many times are a treatment challenge. They don't stay in treatment, they don't maintain their medication regimens, and then they have relapses of what we spoke about earlier, delusions and or hallucinations. And then finally, there is comorbidity between schizophrenia and substance use. Obviously, if you've got these very debilitating symptoms like delusions and or hallucinations, you're going to want to try to mitigate those through self-medication. And that's typically how it is that people who are schizophrenic get involved with drugs and alcohol, because they're trying to mitigate the very serious symptoms that they have based on this behavioral health disorder. The treatment for schizophrenia typically is psychotropic medication. Medications are very effective in dealing with some of the positive symptoms of schizophrenia, that is the delusions and or hallucinations, and then psychosocial treatments to help reduce stress, to support them in the community, and to help them do and be as functional as they can be, given the fact that they have a debilitating disorder. Unfortunately, there are relapses as part of this, and many times schizophrenics will have to be hospitalized. But the good news is that the treatments, including the psychotropic medications that we have, and also the reduction in stress as part of the psychosocial treatment, can be very effective in dealing with schizophrenia. So what you've learned, hopefully, is what psychosis really means, what the hallmarks of psychosis mean, and hopefully this has helped you understand a little bit more about what the disorder schizophrenia is like, what the symptoms are, and then finally, what are some of the relevant treatments.